Welcome back to the Aslan Health Podcast. I'm Dr. Mike Hauman. Today, we continue our three-part series on healthspan versus lifespan. Last time, we revealed the cultural anti-aging mirage and learned that lifespan is the number of years you live, while healthspan is the portion spent with useful function, meaningful engagement, and reasonable freedom from serious disease and disability. We also placed the discussion under the biblical truth that God numbered our days before any of them came to pass. That truth certainly does not excuse neglect, but it does free us from fear. Today, we reset the way we approach common longevity interventions. We briefly review the prescription drugs promoted by the anti-aging advocates. Then we discuss nutraceuticals, what has reasonable evidence, what may help in specific circumstances, what appears promising, and what is mostly marketing dressed in molecules. Your goal is not to acquire the world's largest supplement stack, all in a vain attempt to defy the inevitable. Your goal is a wise health span strategy that makes the most of your God-given life, health, and opportunities. Because a cabinet full of capsules is not the same as a purpose-filled life full of health. Are you ready to reset your approach from lifespan to healthspan, all as you serve your Creator? Well, let's do that together, my friend, because that never gets old.
Welcome to the Aslan Health Podcast, where science meets soul. Your host for this program is Dr. Mike Hauman, an experienced physician, a certified functional medicine provider, a certified insight coach practitioner, and a devoted follower of Jesus Christ. If you're tired of feeling stressed out, exhausted, overwhelmed, or stuck in survival mode, you're in the right place. So take a deep breath. Let's be transformed by the renewing of our minds. Here's Dr. Mike.
Imagine that you're building a house. For starters, you must have a good plan and a stable foundation. When it comes to your health, the foundation is good nutrition, regular movement, quality sleep, edifying relationships, meaningful purpose, preventative care, and spiritual peace. As you build your house, consider nutraceuticals and supplements like tools that facilitate the build. Prescription medications are like specialized equipment that can accomplish challenging work faster at the appropriate time. They both can be useful, even essential when necessary. But no skilled builder begins by hanging an expensive chandelier before even pouring the foundation. And yet, that is exactly how many longevity plans are sold. They're offered as an advanced anti-aging stack before anyone asks foundational questions about your food choices, your sleep quality, your regularity of exercise, or whether you eat enough protein, whether you control your blood pressure, or about your meaningful relationships, your stress level, your mental health, or your spiritual well-being. My friend, that is upside down, and it's not good medicine. So let's begin this reset conversation with 5 anti-aging myths and things to stop. First, stop treating every feature of aging as a deficiency that requires a product. Aging includes real biological changes, but not every change is disease. Gray hair is not a functional medical emergency. And slower recovery at age 65 does not automatically mean that your hormones must resemble those of a 25-year-old. Fatigue certainly deserves thoughtful evaluation, but not an automatic order for 12 supplements and 3 peptides. Second, stop confusing a supplement stack with a wellness strategy. Every added product increases your cost, complexity, and your interaction potential. Start 5 things at once and you'll not know which one helped you or harmed you. That is not personalization, it's unnecessary, expensive confusion. Third, stop accepting a surrogate marker as your final outcome. Raising NAD or reducing an inflammatory marker may be useful, but you should care more about whether you can walk farther, recover well, maintain muscle mass, think clearly, reduce your disease risks, and remain functionally independent. Improved blood markers may be signposts on your journey, but they are not the destination. Fourth, stop neglecting the foundations of good health while simultaneously purchasing the finishing touches and the accessories. You cannot out-supplement intentionally poor food choices or your lack of sleep. You can't preserve muscle without using it. And you cannot compensate for uncontrolled hypertension and unmanaged diabetes with an antioxidant capsule. Fifth, stop self-prescribing powerful interventions because someone used the word longevity. Advanced interventions like hyperbaric oxygen carry substantial risk of complications and potential physiologic harm. I've seen it in my own practice. Prescription drugs are not stronger supplements. They have unintended actions, adverse effects, contraindications, and they demand monitoring requirements. So, what are the options? Well, the first category includes the prescription drugs touted by the anti-aging crowd. Let me state this fact plainly. No medication has been FDA approved to treat aging itself. But several drugs are being studied because they affect pathways associated with aging. That is not the same as proving that they extend human lifespan or improve human health span. The first of these is metformin. Metformin is a valuable and well-established first-line prescription medication often used for managing type 2 diabetes. It's on our list because observational studies in people with diabetes created interest in whether metformin might delay several age-related disease conditions. But in clinical trials, metformin has not been proven to extend lifespan or health span in healthy adults. And the benefit may depend greatly on the individual's metabolic condition. So actually, in one randomized trial, healthier adults taking metformin during progressive resistance training gained less muscle than those taking a placebo. Now, that does not mean that metformin is a bad drug. It only means that the right medication for treating insulin resistance may be the wrong shortcut for a metabolically healthy person and aging. Next is rapamycin, which has some of the strongest lifespan data in animal models. That's why it attracts so much attention. But human aging is not the same as a lab rat experiment with a longer calendar. Rapamycin affects mTOR, a pathway involved in growth, nutrient sensing, immune activity, and muscle adaptation. A recent randomized trial in older adults found that weekly rapamycin use did not enhance the benefits of an exercise program, and it actually appeared to blunt several functional gains. A study like that should make us even more cautious, not less. Any proposed longevity drug that interferes with exercise benefits deserves a very long pause because exercise already has substantial, unequivocal evidence for preserving human health span. Then there are those senolytic drugs intended to remove senescent cells, sometimes called zombie cells. The theory is compelling to scientists because senescent cells stop dividing but continue releasing inflammatory signals. In animal studies, clearing selected senescent cells can improve several age-related outcomes. One such drug is a potent prescription cancer drug. My friends, that's not a wellness supplement. So here's my prescription reset. Use medications to treat an established indication when the expected benefit outweighs the risk. Do not ask a drug to provide certainty that science itself has not yet verified. Proverbs 14:15 says, "The simple believes everything, but the prudent gives thought to his steps." The prudent person is not anti-science. The prudent person respects the difference between a hypothesis, an early trial, and reproducible documented efficacy in real people. So now let's move on to the second category, nutraceuticals. this is where I want to spend some time because supplements are widely available, frequently marketed for anti-aging, and often recommended widely without a clear plan or defined duration for people. So, nutraceuticals can be helpful. They can correct deficiencies, help someone meet their nutritional needs, support exercise adaptation, and address selected symptoms or individual risk factors. But a nutraceutical should support a healthspan plan, not become the cornerstone of the plan. Before you begin any supplement, ask yourself 6 questions. What problem am I trying to solve? What evidence supports this product for that target concern? What form and dose of the supplement were actually studied? What are the risks and interactions for me personally? How will I judge whether it worked? And when will I reassess whether I still need it? I find that for some people, supplements move into their medicine cabinet and apparently sign a lifetime lease. They continue for years because they do not remember why they were started in the first place. So let's replace that habit with a healthy healthspan hierarchy. The first level includes foundational nutraceuticals that help meet a demonstrated need. Number 1 of those is protein. Technically, protein powder is a food-derived supplement, but it may be one of the most useful tools in healthy aging. Muscle is your metabolic reserve and the tissue that allows you to rise from a chair, climb stairs, carry groceries, catch yourself when you stumble, and recover after an illness. With age, muscle becomes less responsive to small protein doses, a process called anabolic resistance. Many healthy older adults therefore benefit from increased daily protein intake, with greater needs during training, illness, or recovery, of course. This must be individualized in patients with kidney and liver disease. Remember, food comes first, but quality whey, milk, egg, or plant protein can close an existing dietary gap. Think of it this way. Protein supplies the building material. Resistance training tells the body where to put it. Number 2, creatine monohydrate. Creatine helps regenerate ATP. That's the cell's immediate energy currency. During short bursts of muscular work, it's necessary. It's also among the most studied sports supplements, and the evidence increasingly supports its use with resistance training in middle-aged and older adults. Creatine may modestly improve strength, lean muscle mass, and functional performance. I advise 3 to 5 grams daily. Loading is optional. It can increase muscle water and serum creatinine, which may complicate kidney testing, so people with kidney disease or uncertain renal function should consult their clinician prior to use. Creatine supports your body's work, however, it does not do the work for you. Number 3 is vitamin D3, which actually is a hormone and not a vitamin. Consider D3 repletion when your intake is low, you have no sun exposure, you have multiple risk factors, or your laboratory testing indicates that you have a need. D3 supports bone, muscle tissue, immune function, and calcium regulation. Correcting a known D3 deficiency is well documented as a good medical practice. However, high-dose vitamin D3 can't prevent every disease or fracture in generally healthy adults. An essential nutrient is not automatically a universal anti-aging treatment. Dose it according to your need and avoid unmonitored megadosing. Number 4 is magnesium. Now, magnesium supports energy production, nerve and muscle function, glucose regulation, and bone health. Begin with food first, leafy greens, nuts, seeds, legumes, and whole grains. And when supplementation with magnesium is appropriate, match the form of your product with the purpose. Like glycinate, pretty gentle, and citrate may help you with constipation if that's a problem. A common range is 200 to 500 milligrams of elemental magnesium daily. Adjust it for your need and tolerance. Again, impaired kidney function requires caution. If you need more help, listen to the recent Aslan Health podcast series on magnesium for all that you need to know regarding the use of this essential mineral. Fifth and final is omega-3 fatty acids. EPA and DHA support cell membranes and participate in inflammatory regulation. Eating fatty fish regularly remains the best foundational support. A high-quality fish oil supplement may be a reasonable choice if fish intake is low, your triglycerides are elevated, or your clinician identifies a specific indication for its use. Always read the label for the actual EPA and DHA amount in your product. Don't merely add the total number of milligrams of fish oil and think that that's adequate. Quality and freshness matter. Review the Aslan Health Fish Oil Omega-3 series released last month for much greater detail. Well, those are the foundational options that I would consider first: adequate protein, creatine, correction of vitamin D, magnesium, omega-3 support when diet or clinical context justifies its use. There are also other wise, conditionally useful options, so let me discuss those as well. Vitamin B12 deserves attention as well in vegans, vegetarians, older adults with impaired nutrient absorption, people taking metformin or acid suppressant medications, and anyone with a documented low B12 level. Vitamin B9 or folate may be appropriate as well. I strongly suggest the L-methylfolate form is the most effective if you do choose to supplement, but folate should not be used to hide an unrecognized B12 deficiency. Soluble fiber, especially psyllium, can be valuable when dietary fiber is inadequate. It can support bowel regularity, improve LDL cholesterol, and glycemic control, particularly when taken consistently with adequate hydration. A high-quality standard dose multivitamin can also serve as a benefit for some older adults, particularly those with a limited diet. It's not a substitute for food, and it's not been proven to stop aging, but recent trials have shown a modest cognitive improvement in some older adults taking a multivitamin. I've also found that coenzyme Q10 is very useful in selected circumstances, including in people with heart failure, fatigue, or statin-associated muscle symptoms, but it's not a universal longevity tool. That's why I prefer the phrase conditionally useful. The question is not, is this supplement good? The question is it appropriate for this individual? For what reason? At what dose? For what duration? And at what downside risk? So far, we've covered my foundational and conditional recommendations. Now we add the promising category. There are several. Urolithin A is a metabolite produced by some gut bacteria from compounds found in pomegranates, berries, and walnuts, and it's attracted attention because it may stimulate mitophagy. That's the cellular process that removes damaged mitochondria. And some trials have shown changes in mitochondrial biomarkers and improvements in muscle endurance and strength measures. However, no study has shown that it extends human lifespan. I consider it promising, but not foundational. Nicotinamide riboside and nicotinamide mononucleotide also are sold to raise NAD levels. They generally raise circulating NAD-related metabolites, which suggests that they may increase available cellular energy production. That may demonstrate biochemical target engagement. However, it does not yet prove improvements in strength, cognition, metabolic health, and disability-free survival or lifespan. Resveratrol, for example, it has excellent theoretical mechanisms, but disappointing clinical translation in humans. Just like senolytic stacks that contain high-dose fisetin or quercetin, there are other molecules. They have intriguing animal and observational data, but we don't yet have strong evidence that supplementing with them extends healthy human life. Then there are the hormones like DHEA and testosterone boosters, which shouldn't be used for casual self-directed experimentation. The same applies to megadoses of antioxidants, which may sometimes interfere with the beneficial signals created by good activities such as exercise. So when it comes to products in this category, more is not always better. These products are better described as biologically interesting than clinically essential at this point. So how do you put this into practice? Here is your HealthSpan supplement reset. Step 1, Make a complete inventory. Write down every prescription, over-the-counter drug, vitamin, mineral, herb, powder, drink mix, and product that you use. Include the dose, frequency, purpose, and who advised you to take it. Step 2, identify the reason for each item. If the only answer is, well, I heard it's good for longevity, place a question mark next to it. Step 3, check for duplications and interactions. Many supplement stacks contain similar ingredients in each product across the stack. For example, you may find iron in your multivitamin, your protein powder, your energy formula, and your beef liver capsule, which can easily push a nutrient to a very unreasonable total daily dose. Step 4, correct genuine deficiencies and meet foundational needs first. That may mean protein, vitamin D, magnesium, B12, omega-3, or other targeted nutrients based on your diet and your clinical situation. Step 5, change only one thing at a time. Choose an outcome and an observation period. For example, select your target like strength gains, sleep quality, or a clinically meaningful laboratory value. If a product produces no benefit after an appropriate trial of 30 to 90 days, then reconsider that product. Your supplements should have a job description and a performance review. Step 6, purchase quality products only. Use reputable manufacturers with independent testing when available. Avoid proprietary blends that hide individual doses in each product. Be cautious with products promising hormone-like or drug-like or rapid anti-aging effects. You can locate links to my preferred professional-grade options in the show notes today, all of which are discounted and available at the Aslan Health Dispensary. Step 7, review the complete plan with a knowledgeable healthcare professional, especially if you take medication, have kidney or liver disease, you're preparing for surgery, you have a history of cancer, are pregnant, or manage one or more chronic health conditions. As believers, we're reminded in 1 Thessalonians 5:21 and 22, but test everything, hold fast to what is good, abstain from every form of evil. That's excellent guidance for life, including supplement selection. Test the claim, hold fast to what is genuinely useful, and walk away from what is misleading, unsafe, or driven by fear. Friend, your body does not need more punishment for getting older. It needs consistent support and wise, faithful stewardship. You do not need to take every product that might influence an aging pathway. You need to do the things most likely to preserve your function and serve your calling. A supplement can fill a gap. It cannot give your life meaning. A medication can treat a disease, but it cannot remove mortality. And the laboratory number cannot tell you whether you're living faithfully, wisely, and well. That is why in our final episode, we'll move beyond all of this. In Renew, we'll build a practical healthspan plan around the interventions with the strongest evidence. We're reminded how to approach this in James 1:5. If any of you lacks wisdom, let him ask God, who gives generously to all without reproach, and it will be given to him. Ask for wisdom, then apply it. Begin simply, correct what's deficient, support what is vulnerable, measure what matters, and refuse to purchase promises that the evidence simply does not support. Well, this is Dr. Mike Hauman with the Aslan Health Podcast. Thank you for listening. Please subscribe and follow for the final episode in this series when we turn the best evidence into a sustainable plan for remaining strong, useful, connected, and faithful throughout every season of life. Until next time, may the Lord grant you wisdom without fear, discernment without cynicism, and the courage to choose what truly supports the life that He has entrusted to you. His perfect peace to you, my friend. Until then.